My name is Dr. Mark Schleiss, and I am a professor of pediatrics at the University of Minnesota Medical School. I've been studying cytomegalovirus for about 35 years. I am a pediatrician by training and specialized in pediatric infectious diseases, but I've always had a particular interest in CMV, particularly CMV infections in newborn infants and the long-term consequences that can happen because of those infections. So that's my main area of research and advocacy and academic expertise.
Hello, I'm Kathleen Smith. I'm with the National CMV Foundation as a Community Alliance Chair for Minnesota. We suspect that I was born with CCMV. At 5 hours old, it looked like I had measles with a rash all over my body. My dad also noticed that my right eye looked a little bit different. A bit of investigation showed that I had coloboma, which can be caused by CMV. At the age of about 4 months old, they noticed that I wasn't responding to sounds. They brought me to an audiologist who did some testing. The first audiologist thought I could hear based off of my responses, but that audiologist was incorrect. My mom decided to look for another audiologist who tested me. My mom hoped to get audiogram results that she could bring back to the public school in Adena. But that audiologist did not believe in early intervention for deaf children. This was really upsetting to my mom, who didn't want to have any negative impacts from my hearing loss. So she brought me to another audiologist at the University of Minnesota, who finally detected that I was deaf. That was in July of 1981. I was born in 1980, so it took them a full year to diagnose my hearing loss.
So CMV is an abbreviation for cytomegalovirus, and that's a big term. All it really means is a large virus that makes cells swell up and look bigger under the microscope. What that really stems from is observations over 100 years ago by pathologists who looked at tissues under the microscope and saw that there were cells that were too big. They were really large. So cytomegaly means big cell. This was before viruses had even been discovered. Viruses weren't really discovered until the 1940s. In the overall scheme of things, not that long ago. But we knew about this disease because there was something that was making the cells look large under the microscope in sick babies. So as time went by, we discovered that that virus was responsible. CMV is an infection that most people around the world get at some point in their life. By the time you're in the 7th or 8th decade of life, 3/4 of all people in the United States and Europe have had CMV. In the developing world, it's actually a lot higher than that. 100% of people get CMV in low and middle income countries. The challenge and the dilemma is the pregnant person who gets the first CMV infection of their lifetime while they're pregnant. If that happens and there's no immunity to the virus can infect the developing fetus, cause congenital CMV. So that's what we mean when we say congenital CMV. It's an infection that you acquire before you're even born. And that in turn can damage the developing fetus and lead to hearing loss and other disabilities as well. So that's the virus. That's why we call it CMV. And it's really the congenital CMV that's the main problem when we talk about deafness, developmental disabilities, and other kinds of long-term consequences for the young child.
Okay, so those are two different things, CMV and CCMV. CMV is just the name of the infection. CCMV occurs during pregnancy, which can cause hearing loss, and that only happens during pregnancy.
So Minnesota in 2021 passed legislation called the Vivian Act. And I've always kind of taken a deep personal interest in that because Vivian was my patient. Her mother and I actually started talking about this in 2015, 2016. It only took us 6 years, which in the world of the legislature and in the world of politics is actually a very short time. We had a lot of obstacles along the way, including the COVID pandemic. But I really have to give credit to parents. It was Vivian's mom, mothers and fathers, lots of families of children in Minnesota who were born with CMV that went to testify at legislative hearings, put on fundraisers, informational sessions. And after some tenacity and persistence, we got that bill passed. So Minnesota became the first state to test all newborn babies for CMV infection. The bill also importantly provided funding. And so the funding is now at the state health department. It's used to monitor and track babies with CMV, to look at their developmental outcomes, most important of all, to monitor their hearing and ask questions about speech and language in babies that have CMV. The most important point about CMV and hearing loss is that perhaps as many as half of all babies who are destined to have hearing loss in early childhood actually pass their newborn hearing screen. They seem to be able to hear normally at birth, but they go on at 3, 6, 9, 12, 15 months of age to develop hearing loss later. And I think Kathleen's story is kind of a testament to this, that if a young child loses their hearing, sometimes it's just not noticed. Parents may not pick up on it, doctors don't pick up on it. And so by testing for CMV and identifying it at birth, we then identify a group of babies that need to be monitored very, very closely for delayed onset of hearing loss. And if you can pick up that hearing loss, then you can offer intervention that can make a big difference for the baby's speech and language development. So that's really what Minnesota has tailored the CMV screening to focus on most of all, is identifying a group of babies that would benefit from very close monitoring and early intervention.
I'm a volunteer with the National CMV Foundation. My job is to provide education and resources to parents who are not sure what to do or where to go to get help. For example, if they're not sure what to do with their deaf child, I can direct them to Minnesota Hands and Voices as a resource. I also encourage OT and PT, as later in life there could be balance issues. I personally struggle with balance because back in the 1980s, they didn't have the resources and knowledge with OT and PT. At the same time, I work to educate healthcare providers because 91% of women and providers do not know about CCMV. There are about 9% who are aware, and that is a huge difference between the two. My job is to provide education and how to reduce the risk of CMV because it's on the rise. We want to reduce the risk as much as possible until a vaccine becomes available.
I think the years ahead are going to be a challenging time for healthcare, incorporating scientific knowledge into medical decision making, and decision making about public policy. And I think it's really important for all of us in medicine, in the community, certainly in our political bodies, to embrace the idea that science matters, that scientific information can make lives better and benefit children. That's what I care about the most because I'm a pediatrician, and families. Part of what we can do in CMV is to advocate for the incorporation of the knowledge we gain from things like newborn screening. My most important answer, I think, would be to embrace the knowledge that we gain and in turn translate that into patient care and development of new strategies to try to decrease the burden that CMV has on children. And I just would like to add that when I say burden, I'm really talking about a financial cost, the cost of providing complete audiology care, neurology care, care for developmental disabilities, care for special needs. But what I'm saying is that if we were able to prevent those things through knowledge, awareness, prevention, and eventually vaccination, the cost savings would be tremendous. Even more important than the cost savings, though, are the benefit that it would provide to families. Families who often go on a search. Some people call it a diagnostic odyssey, a search to try to understand why, try to understand the cause, try to understand the reason. And with CMV testing, now at least we have an answer. But the impact on families is still very large. The emotional stress, feelings of guilt that sometimes families feel because this has happened to them. And so I think the other big benefit, even bigger than the financial benefit, would be the benefit on people, benefit on families, to try to develop strategies to prevent this infection from ever happening in the first place.
We're having a conference coming up in September of 2025. There you will have the opportunity to learn more about CMV and how you can help with this work. Both Mark and I will be there, and we're looking forward to it.
I think the best resource always is discussion with your primary care physician. I think if you're a pregnant person or a parent of a young child, having discussions about these issues with your doctor is always a good place to begin. That's particularly important for a young woman who might be planning a pregnancy or in the early stages of her pregnancy, who wants to understand her risk for this, who wants knowledge about CMV. Pregnant women in practices in the United States today are well informed about a lot of things. I think I have yet to meet the pregnant patient who hasn't been counseled about cat litter, about the importance of not changing the kitten's litter when they're pregnant. And that is important because the cat litter can transmit an infection called toxoplasmosis. Toxoplasmosis can also damage a developing fetus. But in the overall scheme of things, toxoplasmosis is really rare, extraordinarily unusual. CMV, on the other hand, it's the single most common infectious disease in the United States and probably the world that causes disability in children. So I think we need to do a much better job, we as physicians, we need to do a much better job about educating our patients, particularly our pregnant patients, about CMV. So I think if people want to explore this and get information about it, talk to your doctor. The young infant, the newborn baby, who presents to the pediatrician for well child care, who maybe there's a question about that baby's neurologic development, or that baby's hearing, or that baby's growth. Talk to your pediatrician. These are great starting places for knowledge. Now, I think to go deeper, I highly recommend the National CMV Foundation. Kathleen is the Community Alliance representative for the National CMV Foundation here in Minnesota. And it's a terrific organization that has tremendous resources on their webpage, very receptive staff who can be approached by email with questions that arise. And so I think that that's a really good source of information as well. My laboratory at the University of Minnesota also maintains a website where we try to provide some information about CMV. In all honesty, it's not as good as the National CMV Foundation's website, but I field a lot of questions and from families really all over the country, and I'm always happy to answer emails or try to steer people in the direction of getting more information about resources if they have CMV questions. I would like to just thank Kathleen for sharing her personal story about CMV. That's not always easy to do, and so I think it really deserves a gratitude on the part of the community and all of us in CMV research. So thank you for that. I think that it's really important as we look to the future to increase knowledge and awareness broadly across the community. CMV, as we've talked about, is the most common infectious disease in the United States and probably the world that causes disability in children. And yet, when we talk to pregnant people and women of childbearing age, the knowledge about CMV ranks dead last. We are not doing a good job. We, the medical community and the public health community, we're not doing a good job about educating people about how to prevent this infection. So my biggest take-home message would be that we need to develop strategies to increase knowledge and awareness of this. And we need to look to, I think, a very bright future where we can look at behavioral interventions that can prevent CMV acquisition during pregnancy. And we can look at, hopefully, a vaccine in the next few years that could be given to people prior to pregnancy.
Thanks, Mark. I wanted to share a little bit. I am very excited to share that I am writing a book about my journey with CMV. I am also going to the EHDI conference in Pittsburgh to get more information out there in regards to CMV. I think you pretty much said everything.